single compartment osteoarthritis. This can be arthritis of the inside, the outside, or the kneecap joint. We can address each of these problems directly with a medial, lateral, or patellofemoral joint replacement. This means that only the diseased part of your knee is replaced and you keep the good parts of your knees for better use. Apart from being a smaller operation, single compartment surgery of the knee or single compartment replacement of the knee means that the rehabilitation is quicker, the risks of the operation are lower, and patients usually find that they return to their usual activities much quicker than, say, with a total knee replacement. So overall, there are advantages. Osteoarthritis of the major joints, the hip or the knee, should be treated non-operatively as long as possible. That means symptomatic treatment with painkillers, anti-inflammatories, and physiotherapy. Once these measures no longer address the problem, the pain can no longer be managed, then joint replacement is necessary. I'll be very happy to advise my patients on when surgery is appropriate.